Chapter 6 touches upon a topic that I believe is of very great importance for anyone who is considering a practice in the field of social work. That topic is critical thinking. Why I believe that this is such an important topic is because in our work we often are challenged by the lifestyles and the choices that many of our clients make in the course of our interactions with them. And we could find ourselves very easily being in a position of judging those individuals negatively because of that. Critical thinking, among other things, gives us the opportunity to consider alternative explanations and to look, and encourages us really to look much more deeply at what we observe with, well, not only with our clients but in our own lives and in the world around us, so that we can come to a richer and better understanding and a more objective understanding of why things happen the way they happen, why people do what they do, and how we find ourselves in the situations that we find ourselves in. Critical thinking, really developing a critical perspective is something that's very, very important, and sometimes your authors will talk about that in different textbooks and different works that you study. Critical thinking includes things like raising vital questions, researching well-reasoned conclusions after you've gathered relevant information, and maybe most importantly, thinking more open-mindedly within those alternative systems and thoughts. Critical thinking means doing things like identifying your own values, your own beliefs, and your own assumptions, and then questioning those values, beliefs, and assumptions. And in so doing, come to the acceptance that they are just values, beliefs, and assumptions that belong to you. They are not the truth with a capital T. They are your values and your beliefs. And so in doing this, you really begin to challenge and question your own view of the world. And more specifically, I hope in the context of this class and other classes in your social work studies, this will also give you an opportunity to think more clearly about the lives of the individuals that you are seeking to help in this field. If you can't do that, it's going to be very helpful for you to enter into a relationship with mutuality and in a way that can be very helpful to the clients that you encounter. So in this class, in this profession, I hope in your life, as you develop critical thinking skills, you will develop the ability to step back from your perceptions and beliefs about the world and the people in it, and allow yourself to consider that your own view might be incorrect, could be too narrow-minded, could be ill-informed, at least as likely as it is that it's going to be correct. So in this chapter, kind of keep that in mind as we work through the slides. Again, a relatively short lecture on a very important topic, and something that probably is worth further research on your part as you go through your social work studies. Glicken says that Glicken quotes another individual who says that one of the hallmarks of any profession, including social work, is its focus on critical thinking, a higher order thinking skill which mainly consists of evaluating arguments. So in critical thinking, that judgment is purposeful and it's self-regulating. That is, again, that it isn't just kind of a rapid conclusion that you draw or an opinion that you form unless there is a solid basis for that, and that opinion that is based, the information that opinion is based upon comes from really an objective and open-minded look at the situation. More on this as we go along. But the idea of critical thinking is, as Gambrell is quoted as saying, is that it's intended to weed out our biases and the distortions in our thinking that influence how we see things. So in this particular text, Glicken says that critical thinking is the ability to evaluate arguments and to challenge assumptions through a process of asking questions, gathering information, and coming to well-construed conclusions based on this process. Now, Glicken takes some time and kind of takes a look at how it is that we come to know what we know. that social work, unlike chemistry or unlike biology, is not a hard science. And so instead of trying to determine how we combine chemicals to create a certain compound, you can't do anything quite so specifically in the study of social work or the study of human beings, because we are unpredictable creatures. And as you've learned in many different places, it's not ethical to put human beings in a lab and run experiments and tests on them. So we have to come about our knowledge in ways that are something less than scientific, let's say. And Glicken takes a look at this tendency on our part, how we come up with our body of knowledge. And the first one is, he calls it logical positivism, which essentially involves the idea of building a theory through observation. And he says, that this can potentially result in false conclusions because of the fact that the observer himself or herself is going to have a bias, and his interpretation or her observations are going to be subject to the person's own filters. And a great example of this that it's a very challenging example as well that he mentions in the text, is this notion that we all assume in the helping profession, particularly in social work, that child abuse is harmful to people. And he just asks us to step back from that and ask ourselves, what if that assumption's false? What about the people who are able to cope with abusive behaviors and not get help and not have long-lasting harm? In fact, he actually points to some studies of some researchers that were done in the late 1990s that suggested that the impact of child sexual abuse on the emotional functioning of adult victims was very limited, that the impact was very limited. And so it could be that this assumption that our early life traumas cause all sorts of emotional difficulties later in life is incorrect. This is not the first time that this theory has been presented to me. And in fact, I was at an all-day child sexual abuse training a number of years ago when I was still working in child protection and carrying a caseload in Florida. We were just getting to know and understand about sexual abuse in those days. It's an area of child protection and really of domestic relationships that has been an emerging kind of field over the last 30 years or so. And so the body of knowledge is still growing, and 10 or 20 years from now, I suspect you'll be looking at child sexual abuse differently than the experts do today, and seeing it from a much more refined point of view. But in any event, even back in the 70s and the 80s, in the early days, there were the people who were publishing books on child sexual abuse, in particular one that I remember, who said, who's to say that incest is harmful? I mean, if a brother and a sister are engaging in a sexual relationship and they're okay with this and they're taking the proper precautions so that no pregnancy results, why should it be a concern to any of the rest of us if it is a mutual kind of a relationship? Now, that assumes a number of different things about age and power in the relationship and those kinds of things. But he said, the fact is that all the information we have about inbreeding and how, that the risk of all sorts of deformities and developmental problems can result from breeding with somebody who you're closely related to are so much greater, he says, isn't really that much greater. And instead of being 1 in, say, 50 million for one abnormality to occur, the abnormality now might be 1 in 4 million, which is still a pretty extreme, unlikely event. And so his argument was basically that, and this is what challenged us to I think to come up with this, was that really, that objectively speaking, there's nothing harmful about sexual abuse, or at least nothing harmful about incest, is what he was talking about in that context, except for the fact that we have defined it as such, and there is a universal taboo about incest, of course, all around the world. And so this is a little bit of an example of critical thinking, and this is a challenge to the observation that we all make, that our victims, our childhood victims, suffer harm much later in life. Postmodernism is another branch of information collection, I guess you would say, that helps us to develop the theories that we operate on. And essentially, in this particular area, this kind of looks at different ways of research and different ways of developing knowledge and such things, and really kind of comes to the conclusion that many different ways of looking at things are just equally valid. That isn't just scientific study that should be accepted. For instance, kinds of things like intuition, and we often talk about this in the field, that we should follow our gut. I believe I may have mentioned to you earlier that I was told early in my social work training by my interviewing instructor that she could get the sense, and notice her own intuition here, that she had the sense that my ability to intuit where my client was in an interview was very strong, and that it was important for me to follow my gut as I interviewed clients. And in fact, that observation has worked out very well for me over the years in terms of my ability to interview clients and things. But whether it's my intuition or something else going on, who knows, but the importance of spirituality is another thing that oftentimes many people believe should be considered just as important as any kind of scientific data. Other kinds of non-Western kinds of thinking, like approaches to health, like meditation and those kinds of things. Essentially that there's a lot of different ways of seeing the world and seeing the universe, and that we should accept all of these explanations for events and for improvements. The scientific method, of course, we've talked about this, and we really know this is considered to be rationalism, and it's a way of thinking about and investigating the accuracy or assumptions about the world. It's a problem-solving process where we learn from mistakes that we make, and so there again, there's some question about whether or not we can really employ the scientific method in this field of human study, and oftentimes there's some things that seem to operate in our relationships that can't be explained by science, and I believe he points to some studies that say what you want about what theory is best, what practice is best, what technique works best for particular kinds of problems. There's really, according to some people, this the indispensable element. He refers to it as the indispensable element in the therapeutic process that goes on between the therapist and the patient. This rapport, this trust, this confidence. That's that relationship that we talked about, and I'll mention again later in this discussion, that some people believe is critical, and our own experience in working in the field seems to confirm how critical that is, and yet that cannot be explained by science. Another way of gathering knowledge is through the justification falsification process, which researchers gather support to prove certain hypotheses, or gather information to to disprove hypotheses, to discover errors in that thinking, that kind of thing. So the point is here that it's much more difficult to disprove an idea than it is to prove it. So falsification is a much more rigorous effort, and something that requires a lot more work and perhaps knowledge and expertise in order to do. So Glickman's concern is that in this field our knowledge may be mythologized, that it's based upon a number of different myths and beliefs that we have developed over the years, that we have passed on to one another, that we have based our practices on, and perhaps in a justification sort of process, we can all take examples from our practices that will demonstrate the importance of the relationship between ourselves and a client, let's say, that made some changes that couldn't be explained in other ways. We all have those examples. For instance, we all have our clients who suffered harm in childhood, who are experiencing a recurrence of difficulties in adulthood because we believe of the harm that they experienced in childhood. All of these kinds of things we kind of hand down from, let's say, generation to generation, year to year, teacher to student, mentor to employee, whatever it might be. And Glickman wants us to realized that some of these may be myths, that he sees one of the serious problems in our field is the acceptance of knowledge that isn't well documented or that has become mythologized through this long period of acceptance without really evaluating or debate. And again, this is where critical thinking comes in. So mythologized knowledge discourages scientific examination of beliefs and ideas just because we know it. It doesn't matter what the scientists believe. Isn't scientific. Relies on anecdotal evidence, that is, rather than testing out theories and coming up with conclusions based on good tests, we rely on anecdotes. Well, I know this one time. I can tell you about this one client, or there was this one event when. Those are anecdotes. And oftentimes the knowledge that we have in our field, the theories that we pass on to each other are based more on anecdotes than on scientific study. Doesn't include opposing point of views, confuses being open with being uncritical. And I think that's an important point to keep in mind, that not being critical of something can be considered open-mindedness. Well, it could be true, might not be true. That's not the same thing. And open-mindedness still requires a certain amount of discipline and a certain amount of direction, I suppose, in your thinking, whereas being uncritical just is accepting of things. Mythologized knowledge won't use falsification, of course, as a way of understanding information. It tends to use very vague language, really calls on us to rely on faith and to believe the experts and the people who have come before us, and it's really just not testable. And Galic identifies, I think, 4 different mythologies that I think is worth kind of just stopping and thinking about. Let me look at something here real quick. We'll talk about this here. For instance, having a trained and licensed professional is more effective than untrained and unlicensed professionals. This is a myth that he says in the field. In fact, he says no relationship exists among training, licensing, and experience. Empathic non-professionals provide more effective help than trained professionals, according to many studies. It isn't so much the training you have as it is this sense that you can understand what's going on with the other person, that you can meet that person where they're at and respond to them in a way that makes that they know you understand. That human understanding may be the key, more so than any skill the therapist has. Now, that kind of undermines the thing I was saying in the previous lecture about how it isn't true that just anybody can do social work. Is that a myth, or is it not? I want to believe that it's not. I'm teaching social work, and I have a social work degree, and I believe social work is a profession and a specific skill set. Galic in this chapter would challenge us to really employ some critical thinking and ask ourselves whether that's true or not. Another myth: the longer a client is seen by a worker, the more likely important issues will be resolved, and this would result in better functioning. Whereas he says most studies would indicate that there is no relationship between length of treatment and better social functioning. There is no evidence existing to support the notion that more in-depth therapy is more effective than more superficial interventions. In the therapy field, in practice settings and things, there's a great debate among people who prefer different kinds of approaches. There are those who are behaviorists who believe that you correct behavior and emotions follow. There are those who have the opposite point of view, that believe that you have to deal with the underlying issues and the emotions, and then when you deal with them, behavior gets corrected. And so the people who focus more upon the underlying things see behaviorists as superficial, whereas the behaviorists may see the people focusing on underlying issues, more the psychodynamic people, as engaging in some vague and non-specific kind of therapy that has no way of being proved, that kind of thing. And it is one of the things about behavioral interventions is that is more of a scientific kind of thing, and you can track improvement or not. Although, as this textbook points out, there's a lot of different kinds of methods, even in behavioralism, that are used to prove or disprove an improvement in a person's functioning. A lot of different kinds of tests that are used that are probably just as vague and as unscientific as any of the others that are criticized in social work. Another myth: early forms of trauma inevitably lead to problems in later life. And we just touched upon this a bit ago. Research among traumatized children and adults contradict these beliefs, that we all have common stages of development, that childhood trauma always leads to social malfunctioning in the adult years, and that in general, just some relationship social problems are so serious that they're inevitably going to lead to other problems. This may be true for some people, but it isn't true for everyone, according to, well, in your practice, you'll see that. And, we talk a lot about resilient children, for instance, these kids that go through all of these traumas in life and yet still somehow wind up becoming high achieving people who function very successfully in the world. How do we explain that? Well, it could be that the myth behind that whole notion of resiliency is false. The idea that trauma has to cause us to be difficult or to have difficulties later. And another myth: the therapeutic relationship is the key to successful social work practice. This is a myth that is near and dear to my heart, and it pains me to bring this up to you because this is something that I have strongly believed in all the years of my practice. And I can point to a number of different relationships where I believe that's been demonstrated, but there is limited evidence that the worker-client relationship is the key to client improvement. That many of us, and I'm putting in here, including myself, have experiences and beliefs that lead us to believe that the quality of the relationship is the key. But more study is really needed in this field, and that's something that is debated heavily, but it is still, I think, pretty universally believed. So imagine taking any of these myths and applying that critical thinking model to these myths, where instead of just accepting these things, you really open-mindedly begin to explore these myths and see whether there is evidence to support them or not. And if these myths seem to be true, are there other explanations that might explain them? This is what critical thinking is all about. I gave you another example of this from my social welfare class, and if any of you have taken this class with me, 106, you may remember this argument that, well, first of all, you can just start with a question about poverty, and there are a lot of assumptions we have about persons who are poor and why people become poor, and that's a big question. Why are people poor? And that question, usually when you ask somebody, for instance, interviewing for a job with our agency, why people are poor, they're going to tell you, well, it has to do with the fact that, some people, they drink, they use drugs, they don't get the right education, they've grown up in an environment where hard work wasn't taught to them, et cetera, et cetera, et cetera. Really, essentially blaming poverty on the individual. Whereas another way of seeing that involves understanding that there are structural reasons that people are in these situations. I mean, structural meaning societal reasons have a lot to do with the economy. Well, we'll be talking more about this when we get to the unit on poverty here shortly. And that, well, there are many other explanations for poverty that doesn't have individual fault involved in it. But pretty rapidly, the knee-jerk reaction in conservative America, in our capitalist society, in popular political thinking these days, is that poverty has to do with individuals not having jobs. And they don't have jobs because of drugs or education or lack of job training. And so all we have to do is get them trained in jobs, give them more education, poverty will be solved. And it won't work. And we'll talk about more about that later on. But that's one assumption that really, when we ask ourselves, why are people poor? We need to stop and think about that, and think about that more critically. Taking that a step further, people that are poor, say people who are receiving public assistance, there is a segment of individuals on public assistance who choose not to go to work. And of course, these are the people that are deeply criticized by the general public, the taxpayer, that they're lazy, that they're taking advantage of the system, they're freeloading, whatever it might be. And yet, when you look at those individuals' lives, and I'm going to leave it at this because the answer to this is in a textbook in 106, but when you look at these individual lives, there are very solid reasons for opting to stay on public assistance rather than going to work that are responsible parental decisions. Would you believe that? Can you imagine that? It's true, but you don't know that until you really explore this topic deeply. This is critical thinking. This is what critical thinking is all about. And finally, for those individuals who don't go to work and they get this small check, why is it that they all have flat screen TVs on their walls? And how can that be why are they so irresponsible for that? Do you know there's even a good reason for that, and a rational reason for that that has to do with being a good parent. So there are many, many things that we assume about life that we really need to not assume, and in particular about and this could be true about the people around us in our own personal lives as well, but certainly in our professional lives. We need to develop the skill of critical thinking throughout your education, and particularly in this class, please try to employ it as much as possible. As Glicken says here, many authors believe that unless we develop ways of evaluating our work, it will lead to beliefs that aren't really true and will constitute a pseudoscience of which there are a number of examples in medicine and the helping professions. We need to challenge that, and the way we can do this is through the use of critical thinking. So more of that as the semester goes along. I hope this chapter was enough to get you thinking about that. And as always, if there are questions or thoughts about this that you'd like to pursue with me, please do contact me. Thank you.